we are going to go over the multi-skeletal system, which is comprised of bones, which make up the human structure. We are born with about 300 bones in our body, and as we grow into adulthood, the bones will fuse together to become about 206 bones. The bones act as internal armor for our arteries, hence protecting them, and the bone marrow produces our blood cells. We have the muscles, which move the structures. Both bones and muscles are quite vascular. A lot of blood flow goes through them, so if we are injured in either one of them, there will definitely be lower recovery time because there's so much blood flowing through them. Then we have the tendons, and that's between the bone and the muscle. And then we have the ligaments, and that's between the bone and the bone. So the different types of injuries that can happen is a fracture, if it is a bone, a strain, and that's for the muscles and the tendons, and then a sprain for the ligaments. So once again, you have a fracture for the bones, you have a strain for the muscles and tendons, and you have the sprain. The multi-skeletal system is comprised of the bone, the muscle, and the tendons, and the ligaments. So the signs and symptoms. Guiding. And this is a common method that the body will automatically do. Usually it will guide it with the other hand. And sometimes it will physically touch the area, or it would sometimes hover over the area. And that is what we consider guiding. Swelling. Sometimes the area will bruise, sometimes there will be discoloration, and sometimes it will be warm to the touch. So the bruising, the discoloration, and the warmth can happen immediately after any of the three things that happened, which is the fracture, the sprain, or the strain, or it can sometimes happen hours later. Then you have the pain. When you move a particular part of the body, is there heavy pain? Is there pain when you're trying to move it? Weight bearing, when you try to pick yourself up using your hands, is there pain, or is there a jolt of pain? When you try to put your foot down to continue walking, is there a sharp pain around one of the muscles, the bones? And then there's the professional palpation, where you actually try to touch the area and see if there's pain spread out around the area, or if there's a specific spot that is painful. For the general soreness, that's usually a sprain or a strain when you feel the pain using palpation. If there's a sharp pinpoint pain, it's usually a fracture, and sometimes the patient will actually point specifically where they're feeling the pain. So as you can see through the picture, what we have is an angulation. So as you can see with sort of the arm, it's not exactly straight along with the wrist and the hand. It's actually curved over to the left hand side a little bit, and that is what we call angulation. Then we have a compound fracture, and that is usually, you can see the bone sticking up. Sometimes the bone has resetted back into a specific area, but the bone has separated and is compromising the soft tissue. So those are the two sometimes main injuries that we see. So in order to treat, we use an acronym called RICE. So definitely have the person rest, And then we would provide ice. Do not apply ice directly to the skin or to the specific area. You would either want to wrap it up in a triangular bandage, wrap it up in a towel, wrap it up in clothing, but please, please do not apply the ice directly to the skin. And then you can compress it, and you can compress it by containing it, so that way a lot of the blood does not rush down to that specific spot. Hence, vasoconstrict. And especially if it's a foot injury, sometimes we see along with those lines, is we actually keep the boot on. Some of us, we actually tie it a little bit tighter. But please be mindful with the swelling. Swelling can sometimes be so much, it actually acts as a tourniquet and can actually hinder the blood from going to that specific spot. And that is something we do not want. So sometimes if the swelling is too big and if it's inside of a boot, it will start swelling sort of internally and constrict quite the stuff that we do not want it to constrict, so that it will actually end up loosening the boot a little bit. And then we have elevation. With elevation, you want to either move the foot or the feet above the heart, or if it's along the hands, you want to actually elevate the hand above the heart. So it's very important that you act as soon as possible. With every 1 minute that is delayed, it is 1 hour longer in recovery.